Well, I'll answer in general about cancer. I appreciate neuroendocrine as a special category within cancer. Um, what I'm going to say improves your metabolism, your digestion, your ability to biologically detoxify, and does not specifically treat cancer. But I will mention that many cancer experts will tell you to not take any supplements because supplements include antioxidants and other factors. And the cancer chemotherapy that's being given is known to work, to be effective as a pro-oxidative chemical. Almost all of today's chemo. Yes, immunotherapy is beginning to come in, and it's a little different than what I'm talking about, but most chemo is pro-oxidative. Now, very important was my mentor and friend, Dr. Abram Hoffer. He did a 10-year follow-up study on people with advanced cancer, including neuroendocrine cancer, and what he found is when you combine the best chemotherapy with intensive supplementation and nutrition, you get better outcomes. And when you avoid the nutrition and supplementation, you get worse outcomes. How much better? The people on his program that followed his advice lived an average of 10.5 years. The people who followed the advice of their oncologist and didn't follow the rest of his advice lived an average of half a year, 6 months versus 10 plus years. That is a dramatic difference. He wrote a book, the title of which is Vitamin C in Cancer. I could spend hours talking about how dear and special he was, but he did this study that I think is very important, that Linus Pauling thought was very important, that many other people who have looked at it. But unfortunately, too few people have looked at it. You can get that book. It's a used book on, I think, Amazon or wherever you get used books. That was decades ago. I have seen many people who followed his approach, which would be my approach, and combine the best of whatever is our current best standard of care with intensive lifestyle and nutrition. I don't think it can hurt. I am confident that it can help. And very often, unfortunately, what will help is misunderstood in the general medical community. And what they say, like take none a day, is just not the case. I'm not being individually critical. I'm saying that they were misinformed, and they are therefore misinforming their clients, their patients, their loved ones. And I was misinformed at one point, and then I became informed. I collaborated with the NCI. In fact, the NCI got me into the New York Times, but I'll tell you about that some other time. So I have great respect for NCI, but I also respect the limitations of what they do and what they know, because nobody can know everything. Nobody can know everything. I restrict myself to the areas of my ability. And I would work happily in conjunction with any progressive oncologist who understands the value of what we bring to the case, like Dr. Robert Nagorny of Rational Therapeutics in Long Beach, California. He's been getting better outcomes by combining approaches to cancer management, including neuroendocrine cancers, for about 30 years. So I have learned much from him and others, and I want you to benefit from what little and much we know.